today. Welcome to Home Biz Tax Talk. My name is Lysandra Everett. I am the Home Biz Tax Lady, where I help home business owners win the tax game. Home Biz Tax Talk airs Monday through Friday, 9 o'clock-ish. And when you tune into my show, you're going to hear about topics that are important to the home business community. All right, today we're focused on healthcare. I got the question about, has the healthcare mandate or also the penalty been removed? All right. So for plans that are starting in 2019, okay, so when you file your taxes in 2020, there will be no penalty. But for taxes that are being filed in 2019 and previously for when the Affordable Care Act was enacted, then yes, there will be a penalty. So if you did not have health care for the 2018 year, when you file your taxes in, this coming tax season in 2019, there will be a penalty. Now, with that, there are, some changes to healthcare. Now, I don't sell health insurance. Okay. I just know the tax part, but I also research some things so that I can, give you some stuff to think about and give you questions to go ask the people that actually do this for a living. Okay. That's what I do. So, so starting in 2019, there's these things called catastrophic plans. Okay. Listen. We go and read, all right? Because especially when I'm seeing, medical bills for $98,000 for 1 month, okay? That is just crazy. So now before I get to these catastrophic plans and just kind of talking about some of the stuff that's going on, the one thing that I'm hearing, is people will be opting out of healthcare. Okay. So even if you make that choice, you still need to be setting aside money. You still need to be thinking about your health care. Okay. Because the fact is that you're going to need to go to the doctor. You're going to need to get a physical. You're going to need to, if you walk out and get hit by a car, okay, you still have to be able to care for yourself. And, I had a conversation with a young man. He was probably about his late 20s, early 30s. And he was, of course, about healthcare. And I asked him quite simply, well, if you go out here and you get hit by a bus, and you go to the hospital, and he says, oh, well, doctors are required to care for me. I said, okay, but who's supposed to pay the doctor while he's away from his family, because his family got to eat too? Who's supposed to pay the nurses that are there to make sure to assist the doctor, because they got to eat too? Okay. So there's all of these people that are involved in healthcare. And just because you feel like, well, they have to help me because that's the oath that they took, I think that's quite selfish. So, I know that our health insurance system is not perfect. Okay. There's lots of things wrong with it, lots of things that can be fixed, but we also have to take personal responsibility and doing the best that we can to care for ourselves, to have, the best insurance that we can afford, so that, so in the event that something catastrophic does happen, we've got some kind of means to pay for that stuff. Okay. So now let's talk about this catastrophic thing here. Okay, so it says if you're under 30, you can enroll in a catastrophic, let me go back. If you're 30 and older and want to enroll in a catastrophic plan for 2019, you must claim a hardship exemption to qualify. So what that means is they got these hardship exemptions to qualify for these plans. Now, what these plans are, what is a catastrophic plan? Let me get to that definition, because that's crazy too. Okay. So a catastrophic health plan is health plans that meet all of the requirements applicable to other qualified health plans. Okay. But don't cover any benefits other than 3 primary care visits per year before the plan's deductible is met. Okay. To qualify for a catastrophic plan, you must be under 30 years old or get a hardship exemption because the marketplace determined that you're unable to afford health coverage. Okay. That sounds crazy. All right. So in preparation for this, I went to go do a little bit of homework, right? because my family is military, so our healthcare is covered under the military. But I went to do a little homework to say, okay, if we had to go and get healthcare today, what would that look like for us? So I did a little tinkering around, and it's very interesting that now the plans, what you have to do is you need to look at the coverage. Don't look at necessarily at the cost. Look at the coverage that's offered, because there are things like, okay, some people cover vision, some people don't. Some people cover pregnancy, some people don't. Okay, so you need to go through and look and see what the coverage is to make sure that it's even offered. There was one plan that I saw that said, like pregnancy is available. So like, okay, so do I have to pay extra to cover just in case, we decide to have another baby, or, what does that look like? So, so when you're looking at this coverage, don't look at the cost, look at what's covered and what's necessary for your family. Okay. So when we're talking about the hardship exemptions for this catastrophic coverage, which means that you're supposed to have lower premiums. And I get it. Those premiums are out. They just crazy. Okay. The premiums are off the chain. And so the premiums, and coupled with the deductibles, that is a lot of money. So what you need to be doing is going to your HR and looking at different options for paying for your health care tax free. Okay. There are different types of accounts that you can use to fund your health care. You need to go to your HR and look and see what's offered to pay for this stuff, with pre-tax dollars than paying for after-tax dollars. Okay. But your hardship exemptions include things like you are homeless, you were evicted or facing eviction or foreclosure, you received a shutoff notice from a utility company, you experienced domestic violence, you experienced the death of a family member, you experienced fire, flood, or other natural or human-caused disaster, you filed for bankruptcy, you had medical expenses that you couldn't pay. Basically, the only way you get an exemption for just having this catastrophic coverage is if you have nothing. Period, right? We got homelessness. We got to have homelessness before we can get an exemption to get some I would say cheaper healthcare. I wouldn't say it was cheap, but cheaper. So what is the takeaway here? All right. So number one, when you're filing for your 2018 taxes, if you didn't have healthcare for 2018, yes, you will have a penalty. For healthcare starting in 2019, in 2020, no, you won't have the penalty. However, what I do highly encourage you to do is, when you are looking get the best health insurance that you can afford, when you're looking for these health plans, look for what these plans actually offer, not just at the cost. Make sure you have the coverage that you need. If you are self-employed and your business supports your lifestyle, meaning that you are the breadwinner, you are the person that is feeding your family with your business, your healthcare costs are 100% tax deductible. Now, if you have a spouse that has a job and that job offers healthcare, then you have to use that health plan. You can't just say, okay, well, we're gonna pay for health insurance and it's gonna be 100% tax deductible to us. No, it doesn't work that way. If you have a spouse that has a job, then you have to use that health insurance, and you might have some supplemental stuff, but that's your primary insurance. So, the healthcare as we know it is constantly changing. Will the costs continue to rise? I don't know. Someone asked me, after the 2019 year, will you be required to purchase health insurance on the exchange in the marketplace? I really don't have the answer to that. I really don't know. After this mandate is gone, I'm sure healthcare is going to change again. Okay, especially as the legislation, pushes for healthcare to be a state issue versus a federal issue. So then other states might choose to offer some stuff that another state doesn't. I don't know how healthcare is going to look in the next 2 years. But what I do know is that you, as an individual, you have to look and see what is best for your family and do the best that you can there. absolutely, that's the only thing that you can do. The thing that I would not recommend is just blatantly going without health care, without really having a plan as to, hey, if I did walk out and get hit by a bus today, how would that look for me? How would that look for my family? We got to start planning for these things, you guys. This is why we talk about, and this is just like a tangent, right? But this is why we talk about wealth creation and, all of these things, because you know what? It takes money to live. And those that don't have it, you don't get that quality of life. And so this is why, it's a personal responsibility to do the best you can financially, whether that is getting a side hustle and growing it to where it's your only hustle, right? Whether it's, educating yourself to the level that you get a better paying job, however that looks for you, you got to understand that, it takes money to live, and that's the bottom line. Okay. If you don't want to be a millionaire, nobody's saying that you got to be a millionaire, but you know what? I kind of like being a millionaire because, we're talking about, we don't want to outlive our money, right? Because even $1 million is not going to be enough for us to live on. Okay. So I hope that gives you some food for thought. Yeah, that's the long and short of it, you guys. It's not a pretty thing. Like I really like to make these things fun and entertaining, but sometimes it's just not. That's the thing. Sometimes it is just not. But healthcare is one of those things that we need, And, like I said, you do the best that you can to care for your family and yourself, so that especially if you are the breadwinner of the family, you do the best that you can to care for yourself so that you can care for your family. All right. So that's it for today's episode of Home Biz Tax Talk. Again, we air Monday through Friday, 9:00-ish, and you can come here to get your questions answered about your home business taxes. All right. Have a great day, and I'll see you next time. Bye.